Good morning. I'm going to read infection. Fever. A medical student has made some notes on a case report. Case 45. A 24-year-old man presented with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis. For 4 years, early and glandular fever. At the age of 18 years, he had returned from Africa 3 weeks previously. Fever, pyrexia. Fever, also known as temperature. I got a temperature. Adjective: feverish, febrile, and pyrexial. Opposite: afebrile, apyrexial. Some symptoms of fever: sweatings and rigors. Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlikely, unlike many non-infectious degenerative and chronic disease. Finally, many infections are preventable by hygienic measures by vaccines or by drugs prophylaxis. Microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that cause malaria. Another general word for these pathogens is microbes. Patients often refer to microbials as germs or bugs. Notice the common expression for acquiring an infectious disease. Could have could he have caught some disease from the dog? Could he have picked up some disease from the dog? I think I caught the flu bug that's going round. Source and spread of infection. Here's an extract from a medical textbook. Infection may originate from the patient, usually from skin, or from outside sources, often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in the throat. The incubation period is the period between the invasion of the tissue by pathogens and the appearance of the clinical features of the infection. The period of the infectivity is the time that the patient is infectious to others. Thank you. Now I'm going to read the exercise. Match the two parts of the sentence. Look at A, B, and C opposite to help you. 1988 saw the UK launch of Live Attenuate with the measles, mumps, and rubella vaccine. Chickenpox, varicella is a common infectious. Become carriers of the virus. Rabies has an incubation period ranging from 4 days to many months. The patient reigned febrile of AIDS. He has admitted with a 4-day history of influenza type symptoms of fever with rigors, myalgia, and general malaise. Quite a portion of patients who recover from hepatitis B, disease of childhood. The central part of Africa is in the midst of an epidemic of B. Burden from animal to man by exotic ticks. Meales rubiola is most infections during to the catarrhal stage. Lyme disease is caused by transmission, with peaks of temperature of 39.5 Celsius. PUO stands for pyrexia of known origin. Complete the case report of the patient in A opposite. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and splenomegaly in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 or 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of malaria parasite in his blood film. Complete the sentence. An infection which can be treated successfully with antibiotics is bacterial. Another word for an epidemic is outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is apyrexial. The common infection with Epstein-Barr virus is known as glandular fever. Thank you. Ahora los voy a leer en español. Une las dos partes de las oraciones, mira A, B y C para ayudarte. En 1988 vio el lanzamiento en el Reino Unido de la vacuna viva atenuada contra el sarampión, las paperas y la rubiola. La varicela es una infección común en la infancia. La rabia tiene un periodo de incubación que varía desde 4 días hasta muchos meses. El paciente presentó fiebre con picos de temperatura de 39.5 grados Celsius. Fue ingresado con un historial de 4 días de síntomas tipo influenza con fiebre, dolores musculares, mialgia y malestar general. Una porción bastante grande de pacientes que se recupera de hepatitis B se convierten en portadores del virus. El centro de África está en medio de una epidemia de SIDA. El sarampión o rubeola es más infeccioso durante la etapa catarral. La enfermedad de Lyme es causada por la transmisión de Borrelia burgdorferi del animal al hombre por garrapatas ixodidas. PUO significa fiebre de origen desconocido. Completa el informe del caso sobre el paciente A. Al examinarlo, parecía estar enfermo, su ritmo cardíaco era de 100 latidos por minuto, tenía el vaso palpable, la combinación de fiebre y esplenomegalia en este paciente que había regresado recientemente de África sugiere fuertemente un diagnóstico de malaria. El periodo de incubación suele ser de 10 a 14 días. En este caso, el paciente admitió que no había estado tomando profilaxis adecuadamente. El diagnóstico se confirmó por la presencia de plasmodios en su frotis de sangre. Completa las oraciones. Mira A, B y C para ayudarte. Una infección puede tratarse con antibióticos Una infección que puede tratarse con antibióticos es una infección bacteriana. Otra palabra para una epidemia es un brote. Las bacterias y los virus son ejemplos de microorganismos. Alguien cuya temperatura es normal es afebril y la infección más común por el virus de Epstein-Barr se conoce como fiebre glandular. Gracias.